Hello, and welcome to One World, One Health, with the latest ideas to improve the health of our planet and its people. I'm Maggie Fox. Planet Earth faces many challenges: pollution, climate change, and new and re-emerging infectious diseases, and they're all linked. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help. Antibiotics are such important drugs. We need them to treat infections from pneumonia to sepsis to sexually transmitted diseases such as gonorrhea. But antibiotics are losing out to the quick evolution and mutation of bacteria. And in part because they're not especially profitable drugs, pharmaceutical companies are not racing to make them. The result is that drug-resistant superbugs are winning the race. Dr. Manica Balasegaram is Executive Director of the Global Antibiotic Research and Development Partnership. He's chatting with us about why we need more antibiotics and just what kind of new antibiotics we need. Manica, thanks so much for joining us.
It's a pleasure to be here, and thank you for inviting me.
Can you please quickly tell us about the problem of antimicrobial resistance? How many people die every year from these infections, and what other problems do these kinds of infections cause?
Well, infections have been with humanity since time immemorial, and all microbes, whether they're bacteria, viruses, parasites, can develop resistance against the drugs, the antibiotics that we have developed against them. Essentially, what antimicrobial resistance is the ability of a microbe to evolve, develop, acquire a mechanism that allows it to survive an assault of an external assault like a drug. So looking at it from their point of view, it's their ability to survive in a hostile environment, including drugs that humans have developed against them. So it's something that we should just see as a normal course of evolution. Now, why is it important for us? Well, unfortunately, we are developing these drugs because sometimes these microbes can cause infections and it can cause people to get extremely sick. Disability can follow, or even death.
So how can having new antibiotics help in fighting these changing germs?
Well, we just have to remember, people call it an arms race. I just see that as a process of evolution, often accelerated sometimes. But we have to be cognizant that drugs that we've developed over the decades can lose their utility. Not to all bacteria and so on, but maybe to some. And that we therefore have to start getting ahead of the curve and developing new therapeutics, new treatments, new approaches to either prevent infections or to treat infections, particularly the ones where resistance is emerging or has emerged and particularly has been established.
How close are we, the whole world, to completely running out of useful antibiotics?
I think that's not an easy question to answer kind of overall. It's often easier to break that down into, because you've got to remember there are lots of different bugs out there that cause lots of different types of infections. But I think we are in a situation where for certain infections, and particularly caused by certain, let's say, bacteria, we're in a situation where we have less and less therapeutic options, often going towards what we would call kind of last line of defense. And that is, of course, a worrying situation. And so I think we've got to remember that if we want to be ahead of the curve, we have to be extremely proactive. We are kind of behind the curve in several different areas. What are called gram-negative bacteria that cause infections that can be, whether they're lung infections or intra-abdominal infections and so on, that can cause significant sickness and death. There are other infections like gonorrhea, for instance, that can cause significant morbidity and sickness. And here we know that this particular bug is very smart and continuously evolves against all the classes of antibiotics we've thrown at it. We're kind of now, we're using a type of antibiotic that is kind of seen as almost a last line now against it. We're now seeing resistance emergent and becoming established here. There was a recent report even from last week from WHO highlighting this problem. So we are behind the curve here and we have to move fast. And that requires much more effort, more teams working on this and more resources.
And you've hit on this a little bit, but can you help explain why the world not only needs new antibiotics in general, but entire new classes of antibiotics?
Yeah, because we can, of course, churn out lots of different antibiotics of the same class. But looking at different classes and mechanisms of actions in particular means that we can have more heterogeneity of approaches. And that means that we can protect ourselves from emergence of resistance in the future. And you will never 100% protect yourself. What you can do is slow it down or be ahead of the curve. And that's what we need to be. That's why we need to do this. And so that there needs to be more novelty. This requires more basic science. in the areas of different ways of how we can affect the life cycle of bacteria and how we can essentially find targets. And we need to have different approaches to identify. We can identify potential drugs or alternative approaches that can work. And then we need to have the resources to test that. And this is a long, drawn-out process. And as I said, we're behind the curve. So there'll be no miracles that can just appear overnight. This is kind of a continual generational kind of effort that is required. The reason why a lot of people look at conventional approaches, because you often know that you're on safer ground. You often know much more about the approach you're taking. Chances of success could be higher. If you take a very novel approach, there's a lot more uncertainty, and this is likely to fail. Then you add on to the mix that all of this is not really seen as something that is a very commercially lucrative enterprise. That creates a lot more risk around this whole venture. But whether you're doing it as a non-profit or for-profit approach, you still have the same scientific challenges to face.
So you've spoken about the need to not only develop new antibiotics, but to find the right infections to go after. Can you talk about that a little bit?
The aim, of course, is you want to have developed therapeutics or drugs that can target your bacteria or bacteria that you want to target. But you're ultimately treating people with types of infections. So you have to also demonstrate that it will work in these infection types. And the human body is complex. So you have to ask questions like, is what you're developing actually able to go and penetrate into the lungs and be effective when you have infections in the lung, for example, right? So one has to look at it from that perspective, that there are many different angles that one has to cover in the kind of scientific and development process as well. But we also have to look at the population. And a good example of that is that we need to ensure that we do research and understand that we are developing tools that can be used, for instance, in adults, but also in children, and particularly newborn babies that are a very high impacted population here. Taking the kind of integrated approaches is extremely key. Now, that doesn't always happen all the time. A very good example is that it's well known that pediatric drug development, that's drugs that develop, for instance, for children and newborns, lags behind for there's multiple reasons why that happens. But particularly the case of antibiotics and infections, where we know that children are a high impacted population and they are very vulnerable, particularly very young children and newborns. It's extremely important that we prioritize certain populations when we talk about the research process. So, and by the way, it's important to understand that certain approaches may not work in children, or you may find that they are toxic in children. So these are all things we have to take into account when we're trying to identify the right type of treatments for the future.
So tell us a bit more about what you're doing at the Global Antibiotic Research and Development Partnership.
So we're a non-profit organization. Our focus is on global health. So not just the needs of rich countries, but also the needs of low and middle income countries. And our focus is where we're seeing the biggest problems, and what are the biggest problems and where are we seeing these problems and what can we do to help. So we have developed our strategy around focusing on sepsis, including hospital-associated infections that can lead to sepsis, and also looking at children and newborns. And within that, we're focusing on the WHO priority pathogen list, particularly the gram-negative infection. We also have a program on sexually transmitted infections called STIs, which is primarily for the moment focused on gonorrhea as well. And this is something that we were requested to do by the World Health Organization. So we're a public-private partnership. We work with both the public and private sector. We're largely funded by government. And when we work, for instance, with the private sector, we find partnerships with them that bring us into kind of a project where we will support the research and development, but also looking at access, including for high-burden, low and middle-income countries. So areas where our partners may not have a primary interest to go into at the outset. And through this, we have a range of different projects in our portfolio. Some of them are new drugs, for instance, in phase 3. Some are drugs that have been recently brought to the market, but we are partnering with companies to help to expand the access to them. And some projects are really seeing how we can better use old existing generic drugs, potentially in combination.
So what's in the antibiotic pipeline right now? Are there some new drugs coming up?
It depends where you're looking. There's a preclinical and a clinical pipeline, if I can simplify it that way. There's a lot of work done in both areas. So the risk of failure is relatively high in the scientific process when you talk about drug development. So many of these candidates on the list will never make it, even if they are very promising and are novel and so on. The answer is that we have to increase the number of candidates in both the preclinical and clinical pipeline if we want to have success and long-term success. And the output is not just to develop one new drug that's going to save us all forever. As I said before, that isn't going to happen for all the reasons that I mentioned. So we need to have a dynamic process where we can continue to evolve, to look at the priorities, and we need to have a process where, and financing in particular, and incentives that will allow us to ensure that there is a sufficiently robust pipeline, both preclinical and clinical. Now, this requires more work in basic research, it requires more work in discovery, and it requires more financing in both preclinical and clinical development. But one thing I would like to say, which is extremely important for me, is that the innovation is all great, but if these drugs never reach the patients around the world who really need it the most, then it's all for nothing. Okay, so, or at least I would say the utility is significantly diminished. So we have to also find ways of how we can successfully introduce these drugs to the people who need it the most, while also ensuring that these drugs are not overused. And that in its own right is another significant challenge that we have to see as an extension of the whole R&D process.
Manica, thanks so much for joining us.
An absolute pleasure. Thank you very much.
Listeners can share this podcast, which is brought to you by the One Health Trust, by email or on social media. And let us know what else you'd like to hear about at owh@onehealthtrust.org. Thanks for listening.